mountain to the ocean, from the windward to the leeward side. On the island, we do it island style. On the island, we do it island style. From the mountain to the ocean, from the...
Aloha and welcome back. You're watching Rise Above Big Island, which is a 30-minute talk story on health. I'm Dr. Kimo, your host, and we are very fortunate today to interview a friend of Big Island, our Mayor Billy Kinoi. Thank you so much for taking this opportunity.
Hey, mahalo, Kimo. Thank you for coming by.
And and we are on the road now. We're not in the studio, and so we're meeting in the mayor's office. What a privilege!
Yeah, no, this is the people's office, Island of Hawaii in Hilo, Kona. We welcome everybody to come by. This is their office. We hold community meetings and functions. If groups need places to meet or get together, we want to honor or recognize a special resident or citizen of Hawaii Island. We want people to feel comfortable to come by. So come by anytime, anybody.
I noticed that one time you even had when Kotin Wong, you had some kind of Kotin Wong.
Yeah, so we've recognized outstanding community individuals, nonprofit organizations. On one time we for the first time I had some employees tell me, "Wow, we've never come up here." Was our wastewater employees, who when a water pipe broke at the Hilo airport, the only way to fix wastewater pipes that blow is shutting down the system, fix the pipe, and turn back on the system. But what happens is, when you shut the system down, 200,000 gallons of raw sewage per hour goes into the ocean. So it would have took 4 hours to fix this one repair. 800,000 gallons of raw sewage would have poured into Hilo Bay. But county employees said, no, we're not going to let that happen. And for the first time, they jumped in and fixed it without shutting the system down.
Wow.
That was such an amazing accomplishment, never done before, that I had to bring the wastewater employees by just to tell them, so our staff, we make breakfast and, bring employees back just to tell them thank you, recognize them. And I think it's important for us to take the time just to tell people thank you.
And you got some amazing employees. You got some amazing workers. I don't know if but I did invite to the show Bobby Fitzgerald, your Park and Recreation's director. We also had Bobby Kaman. We had Mason Souza.
Oh, no kidding.
Who talked a little bit about being a parent of a child who is in the military and all the concerns, and anxiety that comes about, like, hey, my son gonna come back or what? So you've got hardworking employees and also good people.
Yeah, and I think that goes island-wide.
Yeah.
When people tell me, oh, it's got to be tough out there. A lot of hours, very demanding schedules, a lot of pressure, a lot of challenges. How do you do it? And I said, hey, every day I'm amazed of the incredible people that call Hawaii Island home. You can go into any community, on this island. Hamakua, Kohala, Waimea, Kona, Kau, Puna, Hilo, and you meet amazing people, and they make you want to work harder.
Yeah.
And there's just what people do very quietly. You don't read a lot about some of these incredible people, incredible things they do, but it happens every day. And I think that's what makes our island such a wonderful place to call home.
Yeah.
That I think we all know it. And if you ask anybody, how do you feel about living here? Everybody's like, ooh, I feel great about living here. You ask people who travel the world who live here, they tell you that this is a place unlike any other they've ever been anywhere else.
Yeah.
And that's because of the people and the values that people here carry.
Yeah, that is true. That is true. Now, and you've been working for county government how long?
Oh, I came back from Mayor Kim 2001, just before 9/11. So I've been home a decade now. I left, of course, county government for a little while, opened my own law firm, and of course run the campaign for Mayor of Hawaii Island. And so been in county government almost a decade.
Let me ask you this. Prior to becoming the mayor, you worked with the mayor. So you had some perceptions about what that might be like.
Yeah.
And now that you're the mayor, how close to, different, same?
Yeah, I think same. I cannot claim that I've been surprised too many times, but I think that the sheer volume of requests, working for the mayor, got to work on special projects island-wide, got to represent the county at the state and federal level, got to build a lot of really great relationships that serve this administration and the county well to this day. But, you know, actual management of 18 county departments, you know, having a cabinet of over 30 individuals that, you know, you have to hold accountable, you have to instill your values and vision, and, you know, encourage, empower, support, facilitate, provide resources for people to do their job. And you know, I've always believed and, you know, recognized that good leadership, you know, you've got to, especially as the mayor, you know, you're I'm the chief executive of the County of Hawaii. The buck stops with me. So I recognize that I have to take full responsibility for all decision making, and good leaders that I respect, I notice they take the blame and they give the credit. They don't take the credit and give the blame. You know, there's that saying that you know, success has many fathers, but failure is an orphan. And that's true to regard. Every success that we've experienced, this administration, myself, is because of so many people doing so much for so long. But the failures of this administration, of county government, isn't an orphan. It's my child. You know, there's a single parent. So I take responsibility for that.
Whew, that's a heavy.
But good fun though.
It's a heavy burden.
Nah. It's a great challenge. It's you know, because what is my job? My job is to keep families and children on our island healthy and safe. And you know, I would be doing that even if I wasn't mayor in some capacity. You know, as an advocate, as a coach, as a teacher, as a parent. I mean, it's what we do. All we're doing is, I think, fulfilling the values that our parents gave us. You know, our parents always said, hey, make sure you help other people who are not as fortunate as you. And make sure if you get gifts, that, you know, take the gift, you share the gift. And, you know, me and you, Kimo, we've had the gifts of education, the gifts of good mentors, you know, lots of lessons learned in life, you know, even at our age. And so our job is make it easier for those who, you know, come up next.
That's a good way to look at it. And, you know, you mentioned some people are fortunate, some people less fortunate. People would consider your upbringing kind of tell us a little bit about your upbringing. Some people would consider that, wow, you know, kind of being raised disadvantaged, maybe in a rural area, you know, Kalapana boy. How do you see your upbringing? Fortunate, unfortunate, advantage, disadvantage?
In retrospect, when I look back, me and my sisters, when we all sit around and we laugh about growing up, you know, and when we were young, you know, you always think you're poor, you know, you don't want anything, you know, no more slippers, no more clothes, and, you know, no more nice shoes. You know, you play football, your friends get Nikes, Pumas. I remember I had the OJ Juice Mobile, spot build, and, you know, I had the shoes with the squiggly line. You know what I mean? Nobody know what kind of brand that. You know, kind of Ben Franklin or Crest or whatever. But hey, we make do with what we had. You know, I remember growing up in Kalapana and, you know, smoky time, and you know, we had lauhala mats and kerosene lamps. You know, electricity outhouse.
Wow.
When your friends come, we always used to take them down the beach by the drive-in by Kaimu, because then they got to use bathroom. They can go over there. Because if they're at your house, they ask you for use bathroom. You kind of shave, eh? You got to walk down that path over there between the bushes and, you know, and lock the door with the latch. But now I look back, me and my sister guys, we go, wow, we were so blessed to grow up that way, to have those values, that lifestyle. I wish my kids could grow up like that. But, you know, my mom was from Kalamazoo, Michigan, moved to this island in 1963, met my dad, and, you know, I had me and my sisters, and, you know, we grew up, and, you don't understand socioeconomics, you don't understand race, you know, sometimes you're not sure, right? We all grow up Hapa. I don't know, am I too Haole for the Hawaiians, too Hawaiian for the Haole? You know what I mean? What is Hapa? Hapa what? You know? And I think, you know, and those are questions that we all resolve through life. But, you know, growing up on this island, especially now, I just realized we had the best life growing up. You know, if we looked at it, we could say, oh, we had money, you know, we maybe came from a lower socioeconomic background as described by demographics. But, you know, us, we was like, hey, always had food, always had one luau somewhere at some auntie uncle's house. Felt like had plenty cousins, plenty friends, you know, and everybody helped each other. You know, your friends always gave you something you never had.
Yeah.
You know, that taught you to give somebody else something if they know more.
Yeah.
You know, so I looked at it like life on this island was like on potluck, that everybody gave what they could.
Yeah.
You know, you never had to go to the store and buy the awesomest poo-poo platter to go to the, you know, sometimes you just, whatever had.
Yeah.
But everybody took something. But I never been to a bad potluck.
Yeah.
You know, it was always on. Well, at certain times you get some dishes, you go, whoa. And usually that's the dish you go, whoa. Somebody behind you go, oh, that's mine, try them. Oh, no. But, you know, I think, you know, I look back, I couldn't imagine a better life growing up.
Do you think that potluck style of kind of upbringing, that, you know, that everybody bring everything to the table, have you taken some of that as your management approach? Or?
Well, management approach and I would say a leadership approach. Okay. There's a little difference there. Okay. Like on my management approach, you know, as a chief executive, 2,600 employees, and budget that was $403 million in 2008, now at $367 million. You know, assets, when you combine the assets of the county of Hawaii, we're about $22 billion. Wow. That's a big corporation by any standard or measurement. So what I did, as soon as I was fortunate and blessed, people trusted me enough to elect me as the mayor, I went and talked to every chief executive I could, everybody I knew. Mainland, I caught up some people I didn't know. I said, can I come talk story? Can I ask you questions? And all I asked people was, what was your management philosophy? Went through some management books, some of the best that they were, just to augment or supplement what we knew. And what was amazing is there's a universal thread that people all said the same thing around. And the common advice, common insight, management principles were all the same. It was hire people and surround yourself with people smarter than yourself. Let them do their jobs. Get out of the way. Don't micromanage people. You stifle innovation and creativity, and you prevent things from getting done. And number three, of course, you're the leader. Hold them accountable. You know, you've got to make, you know, as a leader, you got to make the tough decision. Yeah. That's the price of leadership, right? You cannot be saying, let's get a committee and study that. You know, people looking to you to make a decision, knowing that when you make a decision, you know, it might be 51% happy, 49% unhappy. I mean, it might be 30% positive, 70 negative. Yeah. But if you believe that to be the right decision, you have a responsibility and duty to make it. Cool. And so that's management. On leadership, that's where this collaborative, cooperative, bring everybody approach comes together in a potluck. So leadership, I think in a broader sense, is about vision and getting people to work towards a common goal and objective. You know, and what I find is people who say, this is what I'm going to do, and I want everybody to do it, it's not very successful because a lot of issues affect a lot of people, many different community stakeholders across many different sectors in the community, in the economy. So the only way to really get stuff done, especially at the county, you've got to work with the state, you've got to work with the feds, you've got to work with everybody in the community, around the community. And the only way that gets done is bring people together, ask people what they think about the issue, listen, let people contribute in a meaningful way, not just shibai, you know, hey, tell me what you think, yeah, whatever, and then go do what you're just going to do anyway. But actually have meaningful, open dialogue. And at the end of the day, the more people work together, the better they work together, the more likely that initiative, that project, that program, that service gets implemented. So I'm of the firm belief that the better you bring people together, the better you get people to work together, and the better people, or the more people commit together. Like stuff get done, and they go, wow, how did that happen? And, you know, I cannot say, oh, it's because I did them. I say it's because a lot of people spend a lot of time. You know, because it's not like everybody come, everybody agree, and everybody do them. It takes time. You know, it takes time. It's a process. You've got to get people talking, sharing it. Nobody wants to feel like they're being pushed, shoved, or herded somewhere. People, there's a process. But I find the more effort you put in the front of a process, the easier it is on the back end.
I like that. I like that. And you know, so for the viewers, you might be wondering, what does this have to do with health? Let me just share with you. Health is on a continuum. So you got good health is just eating fruits and vegetables, individual choices, walking and all. But health can also be way up here. The policies that we create, decisions that we make, you know, who we give resources to, who we don't. and which area are going to get parks, which not, because people say that just make good health choices, but the health choices we make depends on the health choices we have, and not every community get the same health choices. And what I like about what's happening with the county now is that you guys are putting a heavy emphasis on looking at different districts, looking at the infrastructure. Tell us a little bit about that.
Well, as when you talk about health and safety, we've always taught when we were doing a substance abuse initiative island-wide, and people ask you, well, what's the goal? I said, well, it's not a war on drugs. This is not just arresting people, locking them up, or, like you said, it's a continuum, right? There's a supply reduction, right? That's enforcement, but it's also demand reduction, which is prevention.
That's right.
Right? Benjamin Franklin said, the ounce of prevention is worth the pound of cure. And the investment in $1 in prevention saves you $7 in incarceration or $11 in treatment and rehabilitation. So then we realized the ultimate goal is just having a healthy, safe community. But how do we get to a healthy, safe community? Well, we got to have healthy, safe children. That's prevention. But how do we get healthy, safe children? We got to strengthen and build the capacity of our families, have healthy, safe families. And how do we get our families to make good choices, to have opportunities, to have employment options, to be able to create an environment for their children where there's hope and opportunity? Well, then, our neighborhoods and communities have to be healthy and safe. And so if our kids are our goal and our families are that unit that protects our children, then it's the community that provides that safety net around our families. So how do we keep communities healthy and safe? Well, clearly we have to provide programs for our children to keep them engaged in recreational activities and positive activities, keep them away from drugs, gangs, and violence. So on the county side, we've got to make sure we have recreation options for our youth. But not every student or child has a recreational opportunity near them. So we got to get them from where they are to the activity and back. So that's transportation. So our Helion bus system, we've got to increase our routes. We've got to provide more bus stops. We've got to create circular routes for our kids. So when Puna creates the Puna Panthers and have a Pop Water program, which is this amazing program, wonderful coaches, great community involvement, but the kids, they go KL school, they live in rural subdivisions, then mom and dad working. So we said, the investment in a bus route to get 40 kids per team and a couple teams off the street, and into a positive activity with mentors and role models, that's a wise investment in infrastructure. So that's a healthy, safe component. So when we talk about health, we got to create health of community. Our elderly activity divisions, Parks and Rec, our seniors, senior center in every community. Transportation, also important. Seniors ride free, students ride free. Still yet on the bus system. But our seniors, we cannot cut a program regardless of how tough the economy is. Not a dollar can get cut from that senior program because our seniors have spent their whole life contributing to us. It's our Kuleano responsibility, make sure we contribute to their health and safety. And part of them being engaged and interacting and participating in activities. I mean, on this island, we get the longest running Kupuna Hula Festival in the state of Hawaii. We get Kupuna softball leagues. We get Kupuna recognition lunches. You go, Kimo. There's a boy growing up on this island. The aunties and uncles in that room. Amazing, and it's a great, but so we talk healthy and safe from a policy perspective. If we're not protecting our children and we're not protecting our seniors and providing the requisite services and programs, then we cannot claim we want to have a healthy, safe community.
That's awesome.
So, our policies. The one that stands out a lot, that people see at the forefront, is civil defense, police, and fire. I mean, those three units of government are amazing. I mean, those are first class. Chief Kobajiri, Quince Mento recently retired, Chief Rosario, an amazing team. In the last 3 years, we had Hurricane Felicia bear down on us for a week, thankfully veered at the last minute. 2 tsunamis, one from Japan, one from Chile, so thankfully we've been blessed and fortunate, but we're not going to be as fortunate as blessed forever. It's not a question of if, just a matter of when. And so the better prepared we are, the better our response, the less we have to engage in disaster recovery. So that mechanism is also important. So we've never cut police, never cut fire, never cut civil defense. So like you said, I mean, if you have unlimited resources, hey, everybody can be provided programs, but like a family, like a community, we got to make priorities. And so what we've never sacrificed is our children and our seniors and our police, fire, civil defense. Without those components in place, we wouldn't be honest by saying we're trying to build a healthy, safe community. Then you build the next level of elements that allows us to create this thriving, vibrant community. And that's infrastructure, right? If we don't have roads that allow people to spend more time with their families, less time stuck in traffic.
Yeah.
Now that lends to contribute
Sure,
quality of life.
If I start I grouch you.
Yeah, and if you grouchy for 2 hours, you get home and they go, "Hi, Dad." You know what I mean? And yeah, shut up, get out of my way. Yeah, I'm tired already. You know, isn't that meaningful, helpful, positive dialogue? How was your day, son? Hey, where your homework? You finished yet?
Yeah.
Hey, where's dinner? Mom, dinner. Hey, let's eat dinner and then we do our homework together.
Yeah.
So
it all ties in.
it's all quality of life. Yeah, no, it's amazing. So the one thing is, it's not boring. You know, there's no day goes by without something coming up that gets to the health and safety of people and communities.
Amazing. You know, I work at the Department of Health, and we always have the conversation about, you know, like policy, because we feel that's too far beyond our control, so we kind of develop our own initiatives in-house. But we always would hope that politicians, you know, legislators would have that very broad perspective of health, you know, from the Department of Health, because there's so much a doctor can do in his office or her office, and there's so much choices we can make. You know, there's a limit to that. But when we get that kind of understanding, that's very it's very admirable and uplifting for us, because it says to us as Department of Health practitioners that we're not alone in this.
Oh yeah, no.
You know, it's like you guys are right in there too, and we appreciate that.
No, hey, DOH, you know, Department of Health. I mean, if people look closely at that department, they'd be amazed at how big
it's a big
that department is. Mental health. Hey, you get health information exchange, trying to improve information technology to provide quality, affordable health care to rural communities. I mean, that's an amazing responsibility. But like you said, there's a spectrum, man.
Yeah.
You know, you can talk nutrition, health, prevention, triage, you know, that kind of emergency room, and then one whole series of primary care.
Workforce development. What's the latest on? For a while, there was like physician shortage. Do we still have a physician shortage? Or?
Well, I think healthcare will always be a challenge. I mean, we see a global healthcare crisis. You see a national healthcare, you know, clearly across the state and here. But I think what we're doing on Hawaii Island is trying to insulate ourselves from a lot of the challenges we see. You know, take care of ourselves.
Yeah.
You know,
a couple health fests,
Yeah, so we're, you know, I've got to take a responsibility and get more healthy. But, you know, we're trying to, you know, to see where Hawaii Island is today versus where we were a couple years ago. And this is not this is what we did. This is what the community's done. And, you know, the UH Hilo, University of Hawaii Hilo, College of Pharmacy, you know, they just got accredited. Dean John Pizzuto comes in, out of a vision, takes 90 students, starts hiring faculty. Today we have over 350 students getting a doctorate in pharmacology. We have 100 staff and faculty, world class. People come from all over the country, around the world, to be part of this new cutting edge, innovative. This past Sunday in Waikoloa, Dean John Pizzuto hosted this Phytochemical Society of North America. 500 people, 18 countries, 32 states. The Princess of Thailand, who heads a research institute, was there.
Amazing.
And this right on Hawaii Island, and they all came here to look at this island as a living laboratory to find innovative healthcare and solutions to diseases right on this island. So, you know, that was never on the island of Hawaii, but what that does is you bring in people, experts, researchers, you build capacity. The Hawaii Island Rural Residency Program, you know, studies show that, you know, when we talk about doctors and physicians increasing, they talk about the 3 R's. It's about recruitment, retention, and increased reimbursements. But beyond that, what we found is we want to grow our doctors. And so the John A. Burns School of Medicine has a program that we partnered with, and there's so many people to thank for that. Dr. Chip Hickson, Dr. Neil Palafax, Dr. Ed Montel, you know, the Hawaii Island physician, Dr. Craig Shikuma, Kevin Kurahara. But what they did is, they had a vision for 20 years saying, studies show that where graduate doctors practice their residency is where they're more likely to stay, live, and practice. So we have a Hawaii Island Rural Residency Program, Hilo Medical Center, sorry, got to thank them too. Howard Ainsley, yeah, a lot of people coming on, and you know it's tough. Funding's being reduced, and you know, so you know it's a year-to-year thing, but it's been ongoing now for a few years. I think 6 doctors now have, because of it, stayed, lived, practiced. You know, because people ask me, hey, Hawaii Island, why should you come? Like at APEC, when people ask, well, what's different about your island? I said, you know what, I cannot tell you about this island through a glossy brochure, to a visual DVD with a wonderful soundtrack. Yeah. The best way for me to convey the authenticity, the values, the aloha of Hawaii Island, you gotta come. And when you come, you're gonna stop and go, hey, thanks, sir. Wow, that was amazing. And so we know through our physicians to get teachers, to increase our capacity. We want to bring home all of the wonderful students that have gone on and graduated, gone to graduate school, living on the mainland, living on other islands. We want them to go, hey, come back home. Yeah. It's the perfect place to raise your family and your children. It's a safe, healthy place. Yeah. And we want you to bring your education, your experience, your expertise back home.
Wow.
You know, come share what you have with our community.
Yeah, that's the best way.
Yeah.
It's better than the brochure.
No. Hey, come, feel them, you know, smell them, taste them, you know, because it's real. Yeah. You know, we're not selling something plastic or manufactured, you know, synthetic. I mean, this is, Hawaii is for real.
So let me see if I get this straight as we wind down here. So health is more than just what happens in the doctor's office. It's more than just the choices that we make. That is all. It starts with being, you know, with prevention. So making sure our police and our fire are kind of equipped with what they need so that we can respond to emergencies in an awesome way. It's also making sure that we kind of surveying the resources and seeing who no more, and if they no more, then like if it's transportation, for example, then we try to provide that transportation. Because recreation is health, and it's also about engaging the docs and engaging the community to see how we can build our workforce. So it's kind of like the core of county government, if you think about it, health and safety, no?
Health and safety is our mandate. In fact, it's the public, the county charter mandates the core responsibilities and role of county government is to protect the public health, safety, welfare. Wow. So, you know, when they usually delineate, hey, what is county, what is state, what is federal, us is public health, safety, welfare. But the values, right, that's the difference. You know, any municipality has those responsibilities. But I think here in Hawaii, we grew up with that, right? You know, we grew up with these elements of, we always take off our slippers, our shoes. Anybody's house we go. Even if they tell leave them on, we take them off. And that's because, that's respect. We get this value, this powerful value that everybody respect each other. No matter your title, no matter how much money you get, no matter what race or religion you are. The honor part is, from small kid time, our kids, your kids, I know they do them the same way. They are auntie, uncle, everybody. And my kids don't ask me, why is that my auntie, why is that my uncle? They know that's why that's the auntie, uncle, because we all one family. And I think those overriding principles allow all of us to take care of each other, because ultimately, we all cannot take care of ourselves, but we all can take care of each other. And if we take care of each other, we'll be great going forward.
I love that.
Be safe.
I love that. And in this holiday season, you know, I think that's the take-home message. The present is not as important as each other. We are each other's present.
Amen to that. I agree to that.
Mayor Kinoy, and I
appreciate you, Kimo. Hey, happy holidays to you and your family. Everybody, Shaka, God bless you guys. Kiss your family, hug them, let them know how special they are, and tell your friends too. You know, let's not wait till we got to visit somebody someplace. We should tell each other every day. You know, I love you, I aloha you, I appreciate you. Thank you for everything you do. And thank you, Kimo, for what you do for our community. I really appreciate that.
Awesome. And thank you, Big Island. Hey, rise above. Ahui ho.
Ahui ho.
On the island, we do it island style. From the mountain to the ocean, from the